When you walk in, you're greeted and welcomed, and you're brought back by the dental hygienist who, sits you down in the chair and talks to you about what they're gonna do for the day. It's quick. It's the, checking your teeth, counting them, making sure everything looks right as far as your gums and the health side of things. They'll do a bacterial swab if you want them to, just to see what kind of bacteria is hanging out in your mouth. And if you need to do any other treatments for that, they have a lot of options available that are simple at-home treatments you can do. It's not expensive and it doesn't require a lot of extra time. It's just one more little piece to add to your routine at home in the morning and night. So once they do that piece, it's a floss and a brush. Really, it's about 30 minutes for a standard cleaning. X-rays every 6 months. Very non-invasive, easy. They have their lovely televisions above the seats and you can watch a show while you're getting all that work done. And other than that, it's very simple. Even personally, I've had anxiety in the past about that. I have sensitive teeth, and so any metal objects in my mouth when it comes to the dentist's office causes me anxiety. Whether it's gonna hurt or not, I don't know, but I don't wanna go there. So they're so good about talking to you out in the waiting room. Like if you have anxiety in the waiting room about coming back, they'll visit with you in the waiting room and again, walk through what it's gonna look like and not gonna do anything that you're uncomfortable with or that we don't talk about before we do it. So there's that piece. But then in the chair, I've had an experience with Dr. Porter where I had a sensitive tooth and I absolutely did not want him to touch me with any metal tool because I didn't know what that was gonna do. He was so receptive to that, reassured me multiple times that he wouldn't do that we took an x-ray before to make sure there was nothing there. And so it's that, again, customer service and knowing their patients and talking to them on a human level, like they're vulnerable, we're vulnerable. It's a good matchup that way because they're saying, yeah, we get it. This could be scary. And I know that you might have some past experiences and then I ask you to tell them what has been your experience in your dental history before. What things have happened that have caused you to get to this point where you don't want to come to a dentist anymore? And how can we change that for you? So they're really good at looking at those past histories that have caused that anxiety to happen and then talking you off the ledge basically and offering some other suggestions or new ways to think about dental treatment.